Welcome back to the Imposter Syndrome Show, where I talk about a policy proposal that I've written and feel completely out of my depth. Glad to have you. In case you're new here, I am an LVN in the state of Texas with a bachelor's of public health and a master's of health law and policy, and I'm utilizing that education to go on ahead and pitch a policy proposal to Texas legislature that will hopefully be adopted by the Texas Board of Nursing, and it's designed to reduce staffing shortages, promote workforce retention, and promote professional advancement. Today I want to talk about the implementation plan portion of this policy proposal, and it's not like the sexiest, but it's super important to like the bones of this project. So the first section is stakeholder engagement. What we're going to do here is educate and collaborate with nursing schools, healthcare employers, professional nursing organizations, and community leaders to support the transition pathway from LVN to BSN RN eventually. And then we'll conduct our outreach and provide resources to LVNs and LPNs informing about the new pathway and its requirements. And specifically, we're going to be looking for LVNs that are identified as having practice within the state or around the country if they've been travel nurses for 5 years or more. So for the funding and resources portion of this, I've really tried to kind of reduce the burden on the state of Texas so that we're not looking for extra taxpayer dollars. And so we're going to be seeking funding opportunities such as grants and scholarships to support LVNs and LPNs in their educational pursuits. And these would come from our stakeholders, ideally. Develop partnerships with educational institutions to offer discounted tuition rates for transitioning nurses. And this would likely be only Texas institutions that offer either LPN to ADN, ADN to BSN, or a straight 4-year BSN program, or even an accelerated program. And so the timeline for implementing this would be phase 1, or year 1, policy approval and refinement, committee formation, stakeholder engagement, and development of informational resources such as pamphlets, a website, social media outreach, which can be very effective. And then we move into phase 2, years 2 and 3, rollout of the application process and commencement of the transition program. So this is where we would actually have nurses starting to apply and get into the meat and potatoes of this program. Phase 3 would be years 4 to 7, if I could actually talk today, where we would provide ongoing monitoring, support, and assessment of the policy's impact. And so the next video that I'll be making is what the evaluation and review would actually look like in practice. Stay tuned.